So if you've noticed, a lot of your clients in St. Vincent's, when they sit down, and if the right foot is the hemiparetic foot, it just goes off the floor, okay? So that means they did not use that leg as effectively as they did the other leg. They relied heavily on the other leg, okay? Something that you need to be able to do is right at the very beginning, teach them to get that heel on the floor. When you're walking, okay, when you take a step, you've got to be able to release that heel to take, to advance your foot. And if you don't train them how to release the heel, what happens? So they're back there, and they can't release that heel. They could shuffle, or they could circumduct and bring that leg forward. Okay? Because they're trying to clear that foot, clear the ground, and all that they know best is to circumduct. Okay? So you want to teach them, so when you're walking, when you're moving, you take a step and your knee gets pulled forward. Is that, what muscles are working there?
Hamstrings
No.
for bending it.
No, nothing is working.
Oh.
Gravity is pulling it, it's a passive movement. Once this happens, and as that center of mass is moving over that leg that's in mid-stance, this leg advances forward, okay? But in order for it to go to that passive movement, we don't do anything. With the client with spasticity and difficulty going into that passive movement, you have to teach them how, okay? And one way of teaching them is to start when they're right in the initial stages. So you can go back, right? So can we try to do that here in this position?
No.
No, we need them forward. How would you get them forward? Facilitate, right? So scoot them, right? One hip at a time. So once you've got that, you're going to work on getting that dorsiflexion. So here's what I'm doing. I'm getting that forefoot forward, and I'm using my hand to position that talus in place, okay? So we've gone into extension, and I'll ask her to bring her foot down and place it on the floor, okay? So she gets a feel for what it needs to feel like when that heel is on the floor, okay? So now go into an inversion of the foot. Okay, so she's gone the other way. So here's what I'm going to do. I need to get that forefoot forward, right? So I'm doing this, feel my thumb, I'm going to push it back in place there, okay? Make sure the talus is where it needs to be. Push that forward right there, okay? As soon as you've done all of that, can you just leave that foot there and go about doing the upper extremities?
Probably not.
No. You want to go into function, you can get them to go into sit to stand, and in a little bit we'll talk about getting from sit to stand, okay? So now I want you to go into eversion, okay? So when you go into eversion, that talus comes out, okay? So now we've got to get that talus in place, and we've spoken about this. So get that foot forward. You may need to use your head. So what happens is when you go into eversion, what happens? That leg goes into external rotation. So you can either do this with your hand, but most likely you're going to need both those hands to pull that forefoot forward, to get that talus in place, support that knee, and get that foot down in place.
Isn't that inversion?
You know, so
Because eversion.
let's go ask the PT. Is this inversion? Eversion? I call this supination and pronation.
Supination
I call
and
this-
inversion go together.
Okay, so I call this supination, but I get confused with inversion,
This is
eversion.
inversion. That's confusion.
This is inversion, that's eversion.
No, that's inversion.
That's inversion, and that's what I thought, but when I asked her to do, she did the